Started. So I'm Dr. Twyman. I'm a board certified cardiologist. I focus on heart attack and stroke prevention. Tonight we're going to be talking more about some of the biohacking things that I've discovered in the past few years. So tonight we'll be talking about photobiomodulation or red light therapy. So photobiomodulation, how to use light to affect your biology for a likely optimal change. So photobiomodulation was discovered accidentally in 1967, 1968 by Dr. Mester. I believe it was in Austria. He was actually trying to show that light therapy or laser therapy was going to potentially induce cancer in rats. He was shining the light on the abdomen of the rats, and it actually grew hair or fur on the abdomen. He didn't understand why at that point, and then deep down the rabbit hole they went, and they discovered that it was the light stimulating the mitochondria and the hair cells that made the fur regrow. So that's kind of the mechanism of action that was first discovered, is that it helped with fur growth in animals. So it's definitely developed since then. Most of the research initially was done in Russia, Europe, and only lately has been mostly coming over to the United States. NASA had a big push forward in the 1990s to use red light therapy to help with wound healing, because when somebody's up in space and somebody gets injured, it's a far away from getting help. So they did a lot of the initial research on LED therapy. The majority of the data initially is in laser therapy. But as far as my knowledge, there's no really affordable at-home laser units. So the majority of things are LED units. So there are different companies that make these LED units. This is just a portable one from a company called Photobiomodulation. It has red, infrared, and you can mix and match if you want all red, all infrared, or half and half. Also rocking the Weber laser watch tonight that does red, yellow, green, and blue light that shines into your radial and ulnar arteries, and then does some blood irradiation, but mostly working on the red light. Yeah, definitely the Weber helmet and watch. Yeah, well, might as well do it to show and tell. So I do have the Weber laser helmet right here. Bunch of 810 nanometer diodes in there. Useful for mostly traumatic brain injury, stroke, depression, some interesting possibilities for Parkinson's, Alzheimer's as well. I actually have, let's see, 1, 2, 3, 4, 5 of my photobiomodulation devices in this current room, only because I'm kind of a crazy, cardiovascular biohacker that had that many toys. You really only need one of these things if you want to just get into photobiomodulation. But again, most of the data coming out of Europe, now coming in here. Mostly the biohackers are bringing it up initially, and now it's really kind of getting more mainstream into conventional integrated functional medicine. So the main benefit of photobiomodulation, or what previously used to be known as low-level laser therapy, or LLT, is that it stimulates cytochrome C oxidase in the mitochondria. I know it's a mouthful. So you hear me frequently talk about mitochondria being, integral for heart health. So the mitochondria, the organelles in your cells that make energy for you, they do other things, but the main thing they make energy, they're the engines. They take the light from your environment, they take the foods, strip that stuff down into electrons and protons, and then the light basically energizes the electrons through something called the electron transport chain, ETC. My ETC wasn't working too well for a moment. The electron train is like 5 little fingers. The faster they can pass energy through them, the faster the thing at the end spins and pumps out ATP, or energy. Mitochondria do many things, but it makes ATP, makes water, makes carbon dioxide. You breathe out the carbon dioxide. Mostly concerned about the ATP tonight. So nitric oxide, which you've heard me talk about in other talks, is something that helps with vasodilation, opening up arteries, also acting like Teflon, preventing stuff sticking to your arteries. Nitric oxide is good or bad depending where it's at. Nitric oxide, one of its effects is it actually acts as a brake on cytochrome C oxidase, the 4 cytochrome. So when nitric oxide is sitting there, electrons can't go through to oxygen. And so the ATPase doesn't spin and ATP production goes down. Sometimes you don't want your body to be running full speed. But one of the major ways that red light therapy and infrared light therapy works is that light penetrates into the cell, gets into that mitochondria, and stimulates that cytochrome, and it knocks nitric oxide out of there, and then lets the electrons go through to oxygen to make energy. So the major benefits in the mitochondria is that it releases nitric oxide, which allows ATP to be made. That nitric oxide can be released locally. It's very short-lived, so it'll dilate whatever's nearby, so it'll help open up blood vessels. And it also briefly induces reactive oxygen species, or causes oxidative stress to the cell. So it's like an exercise to the cell. Then the body creates superoxide dismutase, SOD, to quench the oxidative stress. So you stress the cell, it gets more resilient. So it is homeopathic in ways. But the red light therapy, main benefits, more energy in your cells. You can always do it with Mother Nature. Mother Nature always has red light, from sun up to sun down. But if you're inside and you want to kind of get a quick boost, the red light panels can help. So I do have a website, redlightdoc.com, that I have previous videos that I've done. I've done a talk on brain health, done a talk on heart health, musculoskeletal health, also done a talk on what's the difference between red light therapy and sauna therapy. And then one of the most challenging things, which maybe I'll get into a little bit tonight, but is dosage. Dosage is really complicated sometimes to really know exactly what to do. And that's actually probably best done in a one-on-one consult with your provider, so they can know your skin type, what you've previously tried, and what dose might be more optimal for you. But kind of head to toe, what can be treated with red light therapy and infrared therapy? Many things. So hair growth, especially laser therapy, can stimulate the hair follicles, can bring stem cells to that area, and hair growth can occur. Can help with collagen production, so it helps with wrinkles. It can help with oral mucositis, a kind of denuding of the tissue, typically common after somebody has head and neck radiation for cancer. That's one of the FDA-approved treatments for photobiomodulation, is treating oral mucositis. Your thyroid is less than 1 centimeter below your neck, skin, and Hashimoto's or autoimmune thyroiditis is the #1 cause for underactive thyroid. You could potentially lower the inflammation, the oxidative stress, the autoimmune dysregulation of Hashimoto's by using red light therapy to your neck area. That red light therapy would stimulate the mitochondria in the thyroid and would help produce more energy there and help lower inflammation. Hopefully your immune system isn't going to be as active against it. Lots of cardiovascular benefits, which I previously talked about, but potentially has an effect on blood pressure support, can potentially put more energy into the heart, help it relax with diastole, help it squeeze with systole. Hopefully nobody here's having a heart attack tonight, but there was a trial in Israel that people are having the worst kind of heart attacks, like ST elevation MI, were treated with light therapy. It was topical, it was to their shins, stimulating stem cells. It helped decrease the heart attack size. For gut, can help kind of stimulate the microbiome. I know the microbiome's a big topic of discussion in the functional medicine world. It's more complicated than eating clean foods and probiotics. The time of day, your circadian rhythms is very important, but also the light that's actually hitting your abdomen. Those bacteria are 5,000 times more sensitive to light than your cells are, and those bacteria leak light. They basically communicate with light. And so if you put a red light panel on your abdomen, or you have your abdomen exposed to the sun, that penetrating infrared light gets into your abdomen, the good bacteria get more programmed. So you need good light to your abdomen to have the right kind of bacteria in your gut. For testosterone production, can increase testosterone. I've heard anywhere between 300 and 400% if you shine light on the gonads. Helps with wound healing, and musculoskeletal recovery is usually one of the biggest indications for it. So if you want to improve athletic performance, use the light therapy before exercising. You'll likely have more reps, torque recovery. So I've seen some video where they're doing preacher curls, and the people were able to do it for longer periods of time if they were treated with the light therapy before. But the big things that helps with DOMS, delayed onset muscle soreness. It basically helps vasodilate blood vessels, so blood can rush into the area, can pull away all those inflammatory compounds, and decrease pain, which a lot of time the pain from working out is the inflammation coming to that area. So, different devices do different things. Typically, you want to kind of think about dosage as the power of the device measured in watts or milliwatts. You want to actually try to convert over to milliwatts. You need to know the beam area or how big the area is going to be. So like this device, it's right on the skin. So there's no reflection off the skin. So the light can reflect off of it, the cells can absorb it, the light can go straight through, transmit it, or it could scatter, it could bounce around before it gets to where it's supposed to go. So if you use a light therapy panel from way back here, a lot of it is going to get reflected off your skin. And you're not getting a full dose if you're really far away from certain devices. But many devices you're not supposed to be right up near you because some of them put off some electromagnetic frequencies or EMFs. So you need to reach out to the manufacturer of whatever device you're thinking about and get the actual metrics you need to know to calculate the dose. So you need to know the power of the device, you need to know the beam area, and then you also need to know the wavelengths. That one's pretty clear. Almost everybody's going to put that on their website. What colors are the lights coming off of the device? Most of the red spectrum is going to be between 600, 700s, and then the infrared's going to be in the 800s and above. The 800s above, visibly, you can't see it. So if I turn on this device, you might be able to see it. That like 2 of the rows are red, 2 of them look like they're burnt out. The ones that are quote burnt out, that's the infrared spectrum of light. The infrared just penetrates deeper. And different cells respond to different wavelengths of light. I was mostly speaking to the mitochondria tonight, that the red light penetrates and activates that cytochrome C oxidase, but there's other things that the infrared light is better for. So the dosage, you need the power, it's divided by the beam area, times the time, how long you're using it for. So the dosage is going to be in joules per centimeter squared. I have a calculator on the red light dock, so if you go to the manufacturer, if the device you have, you can plug it in there and figure out what dosage is for you. I'd recommend that you need to look into some of the research trials of what you're treating. So the dosages for musculoskeletal health are different than ones in treating heart attacks. So it's not 20 minutes for everybody at full blast. So you got to kind of look into different parameters, because there is something called the biphasic response, where not enough light, you don't get a benefit. Too much light, you inhibit the response, and there's potential harm at a certain point. It's a pretty wide window, so it's pretty difficult to harm yourself with one of these devices, but you do need to work with somebody who knows what they're doing with that. So that's what I want to share with you guys tonight, is kind of an intro to photobiomodulation. For those that joined, thank you. I do have a website, redlightdoc.com, that has my previous videos about how light therapy can be used with the Weber laser helmet for brain health. I have a video that talks about heart health, and I have a video about musculoskeletal health. So I'll open it up to any questions anybody has about photobiomodulation, and maybe I'll do some demos of some of the other devices I got tonight. All right. Let's see, a question coming in. Yeah. I'm supposed to do a chat about photobiomodulation pretty soon on Clubhouse, probably more focused on brain health, so be on the lookout for a message about that. It's not something I'm an expert in. I've just kind of biohacking myself with it. I've not done any treatments on anybody other than myself and family members, but that's kind of the bleeding edge, is using, it's mostly infrared light, because infrared light can get through the skull into the brain tissue, lowers inflammation in the brain, and brings more blood flow to certain areas. The main benefit that brain photobiomodulation is. So good question. How do I feel about using the device directly on the skin? Reflection losses are high, if not. Yeah, reflection losses can be somewhere north of 60% sometimes. So ideally, the device could be on your skin, but you need to know how much EMFs are being put off by the device. This is a battery-powered one, so the EMFs should be pretty minimal. It's not plugged into the AC grid. But again, don't believe the manufacturer. Do your own testing, get your own EMF meters, and measure the RF, the magnetic frequencies and the electrical fields on it if it's plugged in. But for the most part, yes, closer is better, but sometimes the irradiance of some of these devices are reported to be 100 milliwatts per centimeter squared, which would be very powerful, and you wouldn't want to be directly up at the device. You might only need quote 30 seconds of treatment if it was really that high of a radiance. So there's not an easy way to measure that at home. You almost have to kind of take the word of the manufacturer. But there are meters if you want to get geeked out and measure the intensities, the radiances of your own devices. But yes, most time closer is better for most of the consumer devices. And it is somewhat like baking a turkey. You could low and slow temperature turkey for like 12 hours, or you could fry it in a broiler in 10 seconds. But more intensity of photon coming out of your device doesn't necessarily mean you get a better effect. Timing question. A couple things on this. Generally recommend people do it sun up to sundown. Try to recreate what Mother Nature intends. Because some people, it can affect their sleep if they use the high intensity red light at nighttime. If it's just on in the room, it's kind of illumination, that won't necessarily have an effect. But if you're blasting your body with red light, right before you go to bed, it might keep you up. And then kind of frequency, probably 2-3 times a week for kind of quote maintenance. If you have an injury, it's probably daily, maybe even twice a day in certain instances. Question about hair growth. It really would depend on the device. There are some laser caps that you just actually put on like a baseball cap, and I'll have the protocol built into it. I can't answer for sure, but most times it's going to be somewhere between 10 and 30 minutes as a session for that. For the testosterone boost, you can use your imagination, what area you need to shine this on. Again, it depends on what the manufacturer says is the irradiance or the intensity of the device, and then, what your EMF tolerance is from the device. But you're generally probably going to be anywhere between 6 and 24 inches away from the panel for that treatment. The great questions coming back in tonight. So it's hard to see this sometimes, but you can see some of the lights coming out of the Weber. Does a 30-minute session. Supposed to do this once or twice a day. Helps with mood, energy. If I was traveling, potentially helps with jet lag. Actually has some pretty cool adapters for the thing that go in your nose and your ear. They've even got one now. I haven't had this one yet, but go in your mouth. So if you get an oral infection, they'll treat it. So I actually have an interesting study came out on treating COVID-19 with a protocol with it. So the device I have is the Weber Medical's Spectra watch. They used to have an older model. This is the most current model that they have. Weber Medical is one of the leaders in photobiomodulation. They're based out of Germany. They also have the intravascular laser device, IVBI, or intravenous blood irradiation, IVBI, that I've done previously at one of my friends' places here in St. Louis. So you get an IV, you have a little filament that's placed into the IV, and then they shine the light directly into your bloodstream. So that's very helpful for people with chronic fatigue, chronic infections. Some heart disease patients can probably benefit from it. So if you're really sick, then maybe IV might be an option. For the average biohacker or a quote healthy person, it's going to be overkill. So So always use what Mother Nature has. So I'm always going to recommend you're out for the sunrise, getting the light in your eyes without glasses, without contacts. So that light in the morning time, it's balanced blue and red, stimulates your supracosmatic nucleus. It basically tells your brain what time of day it is and how to start making your hormones and neurotransmitters. If you want to use an artificial means of it, ideally use it from sun up to sundown. Photobiomodulation in the morning is fine. Photobiomodulation on sunset is fine. But I would not do it too late in the evening because sometimes it can keep people awake. And then question about the brain info site. Again, Weber Medical makes it. It's called the Weber, I always call it the Weber laser helmet, but I think I actually got the Weber LED helmet. Has multiple 810 nanometer diodes in it. So if you go to my website, Red Light Doc, I have a video that explains it. All right. Good question. So the brain info site too, also I did mention I will probably be doing a clubhouse. I don't know if it's this week or next week, that's going to be talking about photobiomodulation and brain health. Which spot on the body would best benefit for systemic benefits? Typically it's going to be chest. You can also treat the tibia areas. Hello, Dr. Baldwin, thanks for joining. I was just talking about, we might be having a chat in Clubhouse soon about photobiomodulation. So I was going through my 5 devices I'm playing around with in my house right now. So, but for general treatment, typically it's going to be your sternum and your tibia. When you use one of these type of devices, it's going to stimulate the mesenchymal stem cells in those areas. Those stem cells will then get activated and go out to whatever area is injured and start repairing it. So that's actually how they thought the one that treated ST elevation in my patients. They only treated the people's tibias, the bones in the front part of their legs, while the person was getting a heart cath and stents were getting deployed. So they didn't even shine the light on their chest. Just stimulating their tibias was enough to help reduce the infarct size. For the people that are just joining, I was going through, I have a small kind of portable device, but this is one I usually sit on my desk in the morning time. Actually, I read by this one, so it lights up my room enough to read. So I get some face and chest treatment early in the morning time. Once or twice a day, play around with the Weber laser watch. And then I haven't been playing around with it as much lately. I'll probably get back into it soon. But the Weber helmet has like a couple hundred diodes, 810 nanometers, mostly useful for traumatic brain injury, stroke, depression. There's some interesting data coming out on Alzheimer's and Parkinson's as well for it. I have a bigger panel, a couple different EMR techs. Got the FireWave, that's kind of for more spot treatment, and I got an Inferno in the room behind me that lights up the whole entire living room, kitchen, but that's when you can treat pretty much the entire front side and turn around, treat the back side. And then I also have a mat, old True Dark mat. It works, it's just not that powerful, but still have it. All right, I think I got the majority of the questions. So usually keep this at half an hour. If any other questions roll in, I will answer them for you guys. Next week, I'm actually going to do a topic that I've not done before on Instagram. It's a topic that does relate to heart health. You frequently heard me talk about endothelial dysfunction. So the endothelium being the inner lining of your blood vessels. It's 1 cell thick. Your endothelium releases nitric oxide. Nitric oxide is that gas that dilates your blood vessels, acts like Teflon, prevents stuff from sticking to the arteries in the first place. Tonight we talked about photobiomodulation having an effect on nitric oxide. So when nitric oxide is inside the mitochondria and it's bound to that 4 cytochrome, it acts like a brake and it slows energy production. The red light goes into the mitochondria, knocks nitric oxide off that cytochrome, lets the electrons go through to oxygen to make water, ATP, and carbon dioxide. So nitric oxide, depending where it's at, is good or bad. But if you have endothelial dysfunction, you also can have the other type of ED, or erectile dysfunction. I don't really like to use the word erectile dysfunction that much because people, have a connotation of what that means. But if your endothelium isn't healthy to your penile arteries, you may not have the erections that you actually want to have. And it's not something to be embarrassed about. Like 25% of people 40 and above are going to have some type of performance issue at some point in their life. As you age, it tends to get worse because endothelial dysfunction tends to get worse as you age. So there are interesting things that can be done from a non-pharmaceutical, non-surgical method to improve erectile function. There's a new device that's consumer-facing. There is one that's office-facing that helps with stimulating angiogenesis or new blood flow to arteries. The company Phoenix Pro makes a device. I'll unbox it for you guys next week. We'll be talking about sexual health optimization for men, and so this is a topic I've not previously discussed on Instagram. We're going to talk about how do you improve endothelial dysfunction. So if you improve endothelial dysfunction for your heart, you're going to improve the endothelial dysfunction for the penis arteries as well. And then testosterone is important. We'll talk about that, but we'll talk about the Phoenix Pro and how that can be useful for erectile dysfunction. Let's see if we got a few other questions coming back in. So this is a little off topic. Maybe send me a direct message about this, about supraventricular tachycardia. Photobiomodulation, wouldn't necessarily be harmful, but would not be necessarily optimal treatment. So if you're interested in more information about that, just shoot me a message or come to my website, apollocardiology.com. So, oh yeah. I know you're just joining, but I've been talking about your device, Solbasum. So this is my portable device that I like to use in the morning time. I read by it, shine on the face and chest while I'm reading my 10 pages for the 75 hard. So got another question here about, let's see, I got a question about, I think the V-Light. I don't have any personal experience with the V-Light. The V-Light has some different wavelengths of light models that clips to the nose. Your brain tissue is illuminated through your nasal passages. They got some interesting research on their devices. So they were kind of the first to market really with the device for traumatic brain injury, and a lot of the stroke mitigation was used with their device, and a lot of their data is mentioned in the Weber LED helmet inserts and research. And somebody says that they've been using their human strips to test their nitric oxide levels. They're very low. So that's something that I routinely recommend people, biohack for themselves. Is you can get these test strips from a company called Human. They're basically like litmus paper. You put saliva on it. If it's white, your body's not making a lot of nitric oxide, so you're more likely to have higher blood pressure. You're more likely to have arteries that don't dilate well. So you may have erectile dysfunction or less than optimal erections if you have low nitric oxide. But if you're somebody who already has known cardiac atherosclerosis, you have plaque in your arteries, and you're having angina or cardiac chest pain, if your arteries can't dilate, you may have microvascular disease. You may have more chest discomfort because you can't get enough oxygen and nutrients downstream. So low nitric oxide is a definite red flag that you need to work with the doctors to try to figure out what's causing the low nitric oxide and improve it. All right. Do we have any last questions coming in tonight, guys? If not, it's been a pleasure. Red light therapy is something I've been very interested in since 2017 when I kind of got into this biohacking scene. If you're interested in learning more about it, you can come to my website, redlightdoc.com. You can also go to apollocardiology.com. That's my main practice website. I have some information there about these different types of cardiovascular testing. Hoping to be able to expand in the future to offer more of these treatments actually in my physical office. I'll start bringing more of these toys to my office and people can play around with whatever I got. But next week, very interesting topic, talking about the Phoenix Pro and how it can improve erectile function without drugs and without procedures, or I should say invasive procedures, non-painful procedures. So if you're interested in that topic, stick around for next week, 6 p.m. Central Time, Monday night. So guys, have a great week. If you need anything in the interim, just shoot me a message. Take care.